Welcome to another easy nursing review. In this video, we will cover cardiogenic shock. Now let's begin by first learning what cardiogenic shock is. Cardiogenic shock is the failure of the heart to pump adequately. This occurs when there is a drop in blood pressure and blood flow caused by the heart's inability to pump blood as a result of a cardiac emergency, such as cardiac tamponade, myocardial ischemia, myocarditis, or cardiomyopathy. Now, let's go over the signs and symptoms of the patient. The signs and symptoms are the following: hypotension because blood flow decreases below normal, tachycardia because the heart is working harder to keep the body's blood flow sufficient, or sometimes bradycardia, in which myocardial injury causes the heart to beat less than 60 beats per minute. Arrhythmias. This is due to insufficient oxygen causing the cardiac muscle to become irritable, which increases the risk of arrhythmias. Clammy skin because tissues receive less oxygen. Oliguria, which is then the urine output less than 30 per hour. This happens because the kidneys are not being perfused. Crackles can be heard in the lungs secondary to pulmonary edema, meaning fluid is building up in the lungs. Confusion due to poor perfusion. Distended jugular veins, which is an indication of fluid overload or the heart's incapacity to control the amount of fluid entering it. Cyanosis of lips and peripheral extremities due to poor perfusion. Now let's go over important labs and diagnostics. Chemistry. Check electrolytes, kidney function to ascertain kidney perfusion. Calcium level is increased or decreased secondary to muscle contractility. Echocardiogram. This is used to look for ventricular rupture, pericarditis, or valve dysfunction. Electrocardiogram, which will show Q wave enlarged due to heart failure. Elevation of ST waves is a sign of ischemia. Okay, let's move on and learn about treatments for cardiogenic shock. The goal of treatment is to keep the heart healthy until the cause, or etiology, can be identified. Increases in heart rate and stroke volume are necessary in cardiogenic shock to maintain organ perfusion. This can be achieved by using these medications, which are vasodilators, adrenergics, inotropes, and vasopressors. Vasodilators dilate blood vessels to decrease the venous return to the heart and reduce peripheral arterial resistance. Two common vasodilators are nitroprusside and nitroglycerin. Adrenergic agents increase the heart rate and blood pressure. A commonly used adrenergic agent is epinephrine. Inotropes strengthen the heartbeat, improve contractions, and promote peripheral vasoconstriction. Common medications used are dopamine, dobutamine, inamrinone, and milrinone. Vasopressors decrease blood flow to all organs except the heart and brain. Okay, now let's learn about important nursing actions. For a patient with cardiogenic shock, here are the nursing actions. Monitor vital signs looking for changes in blood pressure and heart rate. Monitor heart sounds. Monitor the Swan-Ganz catheter. This catheter is placed into the pulmonary artery for accurate reading pressures in the heart, vessels, and lungs. Test capillary refill for perfusion. Monitor arterial blood gas to learn pH, acidosis or alkalosis, and bicarbonate level. Monitor respiratory status, and place the patient on bed rest. And the last topic to learn is patient education. Patient education is crucial. Here are some important teaching topics. Explain to the patient which symptoms to be aware of and when to call the doctor. Take rest periods. Call the physician if there are signs of fluid overload. Signs of fluid overload include weight gain, shortness of breath, fatigue, and dependent edema. Record weight each day and call the physician if there is an increase of 3 pounds. Change to a low-sodium, low-fat diet. Well, that ends this lesson on cardiogenic shock. Test your knowledge with a free quiz. The link is in the description below.